Good evening, doctor.
Good evening.
Whilst all Emirati citizens in the UAE are covered for health problems, Clarice from the Philippines is one of those who stands to benefit from mandatory health insurance when it's introduced later this year. She was in a car accident last year and with no insurance to fall back on, paying for treatment out of her own pocket cost her a week or so's salary.
Since that accident, it makes me realize that I need to have an insurance. And it's a must. Like you want to buy rice, it's also a necessity to have an insurance here in Dubai. Especially right now, everything is, all prices getting up. And if I'm going to compare it to Abu Dhabi has an insurance, and if they want to have only for the checkup to know if they are good or not, they are only paying 10 dirhams.
From later this year, all new visas for expats will only be issued when evidence of medical insurance is provided by employers. Ravi's firm runs health centres across the Gulf and stands to benefit from the move. But there are concerns about demand growth creating a possible doctor shortage that would push up costs for businesses like his.
This additional patients or additional footfall, as we call it, help us to increase our revenue stream. And based on this, we'll be able to invest more money on the latest technology. Now, the challenges continue to be practically on two issues here. One of the challenge here is that we are able to contain the costs, so which is very, very important in healthcare. And at the same time is the staffing is a challenge. Getting doctors have become very difficult, mainly because of the pay scales and because of the increased demand all over the GCC countries.
At the Dubai Health Authority, they're still putting the finishing touches to the new health insurance rules. Around half of Gulf countries already mandate compulsory health insurance for all, just as in Dubai's neighbouring emirate, Abu Dhabi. So why has it taken Dubai so long to catch up?
It is very important for us to do things right, and managing to get the balance right between sort of access to care and cost of package was very, very important. But also it has to mature and it has to go through all of the proper channels, and there are a lot of checkpoints that it had to go through to ensure that it's absolutely the right thing for Dubai.
Now, some businesses have said that this is going to increase their cost. Is this not going to be something that businesses struggle to cover?
One of the key elements of designing the health insurance model really was managing the balance right between access to care and cost to the economy. So the way it has been designed, it in a very good way manages to preserve that balance. The cost to employers actually is going to be less than 1.5% of their monthly salaries. So if you're paying £1,000 as your monthly salaries, you'll be paying £1,015, and that covers the cost of your insurance premiums as well. So it's an affordable package, and it's smartly designed to provide access to basic care to everyone.
Now, the cheapest insurance package available is going to be around $150 a year. That's a fraction of other health insurance schemes, which can cost several $1,000s or more. How are insurers able to provide this for so little money?
I mean, obviously, we need to make, make the difference clear between two things: quality of care and quality of facility. So in Dubai, you find a consultation, for example, ranging anywhere between $7, $8 per consultation, all the way to about $150 per consultation. So some of these facilities may not look that great. However, the quality of care of treatment is very well monitored and very well, sort of looked after through the electronic system and the different regulatory tools and controls.